video, the journey for instance, we see what with the EMG. The patient that has the massa temporalis, the patient that has TMJ problem, temporal dysfunction, at rest, too much of muscle activity. So the muscle are too activated at rest. This creates tense muscle. When you ask them, maximum contraction, you don't see the peak of force. This is the same that you see also inside about the trigger point. Because densification of trigger point change how muscle will work. You don't have rest at rest when you do EMG, you should see very little activity because the muscle should rest at rest. Okay? We ask the contraction, you see the peak of the muscular activation. When there is densification, this change. At rest, you have a lot of activity, so the muscle is tight. When you ask the strength, because a muscle that is tight is a dysfunctional muscle, cannot create strength, cannot create activation. And when you treat them, this change. At rest, the muscle rest, when you ask the peak force, it changes. Also, if you use a dynamometer, for instance, immediately, you see there is a lot, huge increase in strength after the fascial treatment. Because you change how the muscles will work. This increased concentration, the hyaluronic acid usually comes from injury, immobilization, and alteration of the pH. Okay? Production of more hyaluronic acid, which at the level of the fascia, too much hyaluronic acid is not good. Because the molecule start to attach together instead of being attached to water. You need the correct amount. Okay? This can happen because of trauma, alteration of pH, which could even be related to nutrition, or with nutrition. In the pH, we see that basically when we have, this is muscle pH, it's not blood pH, okay? When you have a level, example, about 7.4, 7.5, you have a certain amount of Pascal per second, which is the measure of the viscosity complex. When it becomes more acid, let's say around 5, 6, it becomes more dense. So basically what happens is that when there is change of pH, become more acid, the hyaluronic acid become more dense.
Does it start to like affect the fascia by deteriorating? Like, so if it starts to deteriorate, it starts to dense?
Even lifestyle, because people maybe use more, or eat too much of processed food, probably fascia becomes more dense. Okay? This can also explain why, example, people that have not good conditioning, they produce too much lactic acid, which is not reabsorbed quickly, and it can create, it's too cold now. Yeah, but for the fascia it's not good. Let's heat up a little. Yeah. My God. So you have an athlete, it's not in good condition, start to run 5 kilometers, a lot of production of lactic acid. The system does not work so well, so it does not reabsorb quickly. The lactic acid decreases the pH of the muscle, and then these patients have to feel tightness in the muscle. But in the ultrasound, basically what we see that densification looks like a thicker fascia. You mentioned that it's a bit smaller. I will send all the articles about it. This is a study about TMJ, about the neck pain. The fascia of the anterior part is the muscle. The ultrasound thicker, but not thicker because of the white layer of the collagen fiber, but because of the black layer, which is loose connective tissue. When you treat them, the thickness decreases. The patient improves range of motion, decrease pain. When you use another way, which is this is elastography or elastosonography, which is a way also used for the angiologists for the circulatory system, to see if the tissue is soft or not. In this case, the software showed the soft tissue in red. So this is after you see the after you see that now the light. This is blue and green harder tissue. This is a point around the gastrocnemius. After and before the treatment. So before the treatment, the tissue with the softness is less. After treatment increase. So basically the tissue after treatment become more soft. This is a hypothesis we published about how, example, at the level of the fascia, there can be a peripheral contribution to spasticity. Of course, the original lesion is central to spasticity. Which people have strokes, start to have paralysis at the beginning, this then increase extracellular matrix, they start to have increase of the muscle tone. When the spasticity is already installed, this basically has sort of vicious cycles, more spasticity, more fibrosis, more pain, more post-adaptation, decreased quality of life. When you treat the peripheral part and you improve the tissue, then there is an improvement even if centrally there is no change. Because there is a peripheral adaptation. And this also works for injury, also for pain. And you can even have patients that have static pain that is due to alteration in periphery. So just to conclude, we have two main types of alteration of fascia: densification and fibrosis. The fibrosis is very difficult to change. Densification is very easy. Okay, so just now conclude how we can change the densification quickly, because it's reversible by increasing temperature. So when we have an increase in temperature, increase of few degrees. Here is written 40 degrees, but it could be around even 37. So a little increase locally of the temperature, the molecules of hyaluronic acid are stuck together, they uncouple, they free themselves, and they start to join again molecules of water. So it becomes a lubrificant again. It's a little increase in temperature that can be easily done by myofascial therapy, even massage therapy, massage, okay? Has to be a local increase. This is a study we show that the fascial inflation will increase 2.4 degrees Celsius. There were no patients, people that were submitted to the treatment without any complaint, and they show an increase in temperature, so increase in temperature, free densification, and the other things is that we create also mechanical stress, because not the heating only will probably not remove total densification. So you need also mechanical stress. And with this specific point, we will see now why this specific point, which are the point of connection between muscle and aponeuric fascia. But more importantly, is that you need pressure for a certain friction for a certain amount of time to increase temperature and create mechanical stress. Temperature free the molecule of hyaluronic acid, and the mechanical stress break down this molecule of hyaluronic acid, destroy this big molecule of hyaluronic acid, and then the movement creates new hyaluronic acid in it with water that work as a lubricant. So basically, increase in temperature and mechanical stress create a process that breaks down densification. This can be made easily by manual therapy with friction. Fibrosis is much more complex. You can improve the patient, but probably at the tissue level, you will still have densification. Okay? Now we go back because there was a lot of things, and then we move on more in the practical part. Yes?
Okay. So we do a break, and we just go down to have a photo with the IPM, because today we do a photo. Why we photo? Because Marco don't know.